we're going to get started, but thank you guys so much for coming tonight. It's a wonderful group, and I'm just so honored to be able to stand here today and present as much information that I've tried to learn and gather for myself over the years to present to my patients, to loved ones, to guests. So it's truly an honor. My name is Dr.Ben. I'm a chiropractor at the Chiropractic and Physical Therapy Center in Fairfax. I've been doing chiropractic for a long time now. Before that, my first love was overall nutrition and health. A little bit about my background. Before I was a chiropractor, I was a personal trainer for many, many years, about 10 or 11 years, as well as a competitive bodybuilder myself. It actually started as a kid at a young age of 12, where a life-altering experience that happened to me at a young age. My grandmother was terminally ill with cancer, and she passed away. And I was kind of there that weekend that she passed, and it really kind of woke me up to want to do more for my health and my family's health. So at a young age, I started studying nutrition and exercise and trying to transform my life to be healthier. And then that led me into learning more and more about the human body, which got me into chiropractic, which is all about the nervous system and our joints and spine, which we're going to talk a little bit about. But the biggest area we're going to talk about tonight is the brain. The brain is a very vital part of our health. And again, part of my childhood, I grew up with a very close friend of mine that was my best friend growing up, and unfortunately he was diagnosed with a neurological disease that caused a lot of degenerative problems as he got older, and that really inspired me to try and also learn more about the brain. So beyond chiropractic, I also do postdoctorate work at the Carrick Institute of Neurological Studies, where I study neurology, neuroscience, neurochemistry, to try and find more understanding and answers for our families and our health. So we're going to talk a lot about how to stay healthy, how to keep our brain healthy. Our lecture tonight is called Renewing the Aging Brain. So how many people here feel that their physical health matches their brain health? What's the question? Well, Tom, we already know about it. Don't worry, we have an answer. Our brain is a vital part of our body. It's the most important organ that controls every other aspect of our health. Our heart, our lungs, our digestive tract, our skin, our bones, our muscles are all connected to a vast nervous system that goes through our spine to our brain. So our spine acts as a conduit with all this information relays from our body to brain to keep us healthy. So there's a lot of chronic neurological conditions and things that are very concerning, especially with the aging brain. So to really understand the aging brain and how to help slow down that process of aging, we want to get a better sense of where it starts, how our brain functions. So we have our brain, and our brain is made up of cells, billions upon trillions of cells, called neurons. Neurons are nerve cells, just like a muscle cell or a different cell in the organs. Our nerve cells are what connect us, and our nerve cells are in bundles to the trillions in our brain. So we're going to look a little bit deeper inside the brain and get a sense of these neurons. Now, these brain neurons, our brain tissue is made up of this. All the tissue is water, blood, and brain cells. And on the inside of the brain, they're made up of all these little guys that may lag a little bit with the internet connection here today. But that's even better, because all these little cells you see here send electrical messages down that line called the axon, it's like the highway of the nerve, to the next nerve down the line. And nerve cells fire a signal to make things happen. Think of the electrical wiring going from your house to the electrical power to the city. That's what's happening to our nerves. They send messages down the line to the next neuron cell to make things happen. So when I move my arms, my brain sends signals to my muscles, and they connect, and they send signals back to my brain, tell me understanding where I am in space. There are nerve cells that go from one nerve to the other. It goes down to our organs, our skin. So every part of our body is connected to our brain, this vast network of cells. And it's very important because that's what, over time, breaks down in the body that causes a lot of these problems in the body over time. So I mentioned we have a cell right here. It sends a message down the line to the next brain cell. And you can see on some of these where they connect to the next neuron, basically there's a little cleft, a little space in between, where little chemicals are released that signal the next neuron. So I mentioned the analogy of the electrical wires from your house. They go from dot to dot to dot, from A to B to C. But before the A gets to B, it sends a signal, a chemical release of chemicals, that then tells the next nerve to turn on. So literally these nerves fire and chemicals release in order to keep that message, kind of like a game of telephone, down the line. But you guys have played telephone as a kid. What happens after you get to 10, 20 people? That message is a little bit forgotten, a little messed up. And that's what can happen over time with our nerve cells. A little bit more eloquently, though. So what we have to understand is how to help these areas of the brain function, and what happens over time as we age, these cells become less functional and less reactive to the world around us. So there's a lot of aging conditions that take away from our health, but there's one specific condition that is becoming a big, big problem in America. There's an area in the brain that controls nerves that help with memory. Some people have better than others. And other factors of our health, our cognitive decision-making. What condition do you guys think I'm talking about? Alzheimer's. Alzheimer's disease is becoming vastly and vastly a very big problem in America. So Alzheimer's disease, we have to learn a little more about it to understand it. Alzheimer's disease is a big, big issue in America. In the U.S., death rates have increased by 55% just in the past 15 years. And this takes into account, we are better at diagnosing this day and age, but taking all that into consideration, it's still 55% increase. So as time goes on in our society, we're having more and more instances of Alzheimer's. It's the sixth leading cause of death, and the fifth leading cause of death over the age of 65-year-olds. The average cost for taking care of Alzheimer's patients in 2010 was $200 billion. Now that takes into account direct healthcare expenses like doctors and nurses treating the patients, housing, residential housing, whether it's in the nursing homes or assisted living homes, but also all the indirect expenses of the caregivers. Now when I say caregivers, I'm not just talking about nurses, doctors, and healthcare providers, but we have to think about the families. We all have loved ones who are getting older, and ourselves getting older, and our parents, our siblings, our kids are being left with a lot of the burden of this condition. So even the hours missed from work, missed from all your activity to take care of your loved ones, feeds into these costs, and they're only getting larger. In fact, it's been estimated, and this is actually a mild estimate, that in 2040, $500 billion cost will be the average. Some researchers actually believe $1 trillion by 2050. So over the course of time, we're just simply not going to be able to handle that expense. It's going to take away from our country and our health. So we have to do things early in life to really try to mitigate these factors that affect Alzheimer's. Cancer and heart disease are some of the highest conditions that cause death in America, but they're actually slowly decreasing. Slowly, but things are actually getting better with acute care, with emergency care, especially with heart attacks. So we're getting better treating these conditions, but Alzheimer's is only increasing. So it's not the number one most common neurological condition, but it is the fastest in its growth, and it's going to cost us a lot of our health and our family love. So we have to understand it more to really get a sense of why this is increasing. Okay? Alzheimer's disease. What is it? It's a chronic neurological degenerative disease. When I say degenerative, it means breaking down. Just as we get older, our skin may get a little looser, our organs may not function as well as they're supposed to. The brain starts to age over time, and these proteins and structures in the brain starts to age as well. And gradually, that process has been accelerated through our health, through our society. More damage is being occurred. Loss of neurons and synapses. When I said synapses, that's where those nerves I mentioned, they meet and connect to send chemicals to send the next neuron down the line to send that message. The brain cells and the synapses gradually get more degenerative with age, and as they degenerate, they break down, and the debris. Imagine if you have a big water balloon and you pop it, everything gets everywhere. When the cells break down, toxic waste from inside the cell and debris starts to break down as well. So when we look at a healthy neuron, a healthy brain cell, compared to one in Alzheimer's, there's a few things you see here. In a healthy cell, we have a healthy looking nerve. It sends signals to the other nerves down the line. But when you have aging of the cell and degenerative problems, inside the cell you see these little tangles. They're called neurofibrillary tangles. And basically there are protein molecules that unravel and break down inside the neuron. And as the neuron is destroyed and it breaks, a process called apoptosis, the cell gets destroyed, it releases all the debris. And what happens, if some of you guys are familiar with Alzheimer's, as this debris releases, things start to clump together. Protein molecules come together, the waste comes together, forming plaques called beta-amyloid plaques. And when you have these plaques, they're called beta-amyloid plaques and neurofibrillary tangles. Everything just gets tangled up. Not only does it cause a spatial issue, but also all the surrounding neurons start to act erratically, dysfunction, and the disease spreads to other surrounding cells. Not very different from cancer, with cells becoming mutated and abnormal. Brain cells become gradually mutated and abnormal and start to break down. And memory cells are the ones that are most highly affected in Alzheimer's. As you saw in that video, there's different types of cells that have these different types of chemicals. And your brain cells that involve memory have a chemical called acetylcholine. Acetylcholine is the chemical inside the cell that's released to signal the next cell. So these are the ones being targeted with Alzheimer's. So why is this happening? What are the risk factors? Can anyone guess what the number one risk factor is with Alzheimer's? Any guesses? You guys are in it now? Stress, sugar, what else? Sleep. All things that feed on exercise. Unfortunately, the biggest risk factor, meaning what is most linked to causing Alzheimer's, is age. So, I know that sounds very inspiring, but that there's many things to do that we can control. Age is the biggest factor. Also, a lot of people talk about genetics and heredity. The good news is that in the very small cases do we see that being a big issue. There's a condition in Alzheimer's, basically in Alzheimer's, it's an aging condition. So it is much more common in those who are older, so at the age of 65, and every 5-10 years the risk factors double. Okay? But under that age, in the 40s and 50s, there's a condition called early onset Alzheimer's. And that is much more hereditary linked, where there can be genetic predispositions to have Alzheimer's in the family and pass it down. But that is actually 1 to 5% of cases. So there are genetic links, there are genomes, but there are also not the biggest factor. In fact, besides heredity, there is a genetic precursor that's been found that we can test for that has been shown to increase risk. However, there's a few countries in the world that have the highest amount of people with this gene, but have much lower rates of Alzheimer's because Alzheimer's depends on other factors. And that's what we get to tonight, the environmental factors, what we can control. And everybody said it, sleep, nutrition, exercise. You know, there's a doctor, a very, very good neurologist, Dr. Daniel Amen, who's written many books, Change Your Body, Change Your Brain. Change your brain, change your body. There's many additions because when we take care of our body, all the things we do affect our brain. So we're going to talk a lot about different aspects of health. And I know there's a lot of very smart people in this room, and there's lots of things in the media, news articles, papers, studies that are always back and forth about this supplement, this nutritional technique, this amazing tip of the day. I cannot promise you a magic cure, but what I can do is try and piece things together. Because there's so many different things that have been shown to help with the brain, and the reason why there's so many things is because there's different aspects of our health that feeds into the brain. Basically different categories. Tonight we're going to categorize the things that affect the brain the most, that's been the most research to show can reduce the risk of Alzheimer's. And we're going to break them down into 4 categories and things that you may have heard of, and then we're going to fit in each one. But when we look at the brain, this is the big picture. The aging brain. Neurodegeneration. I want you guys to, this is synonymous. The term neurodegeneration is what you'll see in research articles and papers and how it's referred to when the brain, think neuro, brain, slowly breaks down. And there are 4 pillars of brain health that can either help or hurt the brain. And as we're going to go through this tonight, you're going to see that they're all interrelated. The thing is, guys, when you do different aspects of your health, like these 4 pillars we're going to talk about tonight, it can synergize and really optimize our health. Now, synergy has been thought of as a good thing. 2 things separately coming together making a greater effect, right? But synergy can be a bad thing in the scenario that if you do all these things improperly, it creates even greater risk of disease. So, before we get into the pillars of health for our brain, we're going to zoom in a little bit and understand more about how all those pillars affect the big problem, the chemical release in the brain. The chemicals I mentioned earlier, acetylcholine, those are cells in an area called the hippocampus, the memory center of the brain, that sends release of these chemicals to activate memory cells. Now, acetylcholine is a chemical that's not just used for memory. It's actually a really important chemical that also controls all the dilation of blood to our muscles. So acetylcholine also controls our energy and our muscles and our movement. So it's really, really key that we optimize health. Dopamine is another pathway. These are all different types of cell chemicals that can cause other neurological diseases. Dopamine When you start to see cells being destroyed with dopamine, that's where Parkinson's comes in, and Huntington's disease, basically movement disorders. Serotonin, there's probably people who are familiar with serotonin, SSRIs, basically for antidepressive symptoms. And serotonin is the feel-good hormone, the feel-good chemical, I should say, not hormone, but it's called a neurotransmitter, the chemicals in the brain. And when we have less and less cells get destroyed or altered, it can cause symptoms of depression or anxiety. And GABA. GABA is the calming, relaxing chemical in the brain that when there's less and less of it as we get older, as it gets destroyed, it can cause seizures and epilepsy. So all these different chemical pathways can get degenerative and damaged, and our cells can be destroyed. So instead of trying to always focus on treatment, because there's so many treatments out in society, but the biggest thing, guys, is when you already start to see symptoms, we're already starting to have more cells destroyed in the brain. In fact, with Parkinson's, a side note, when you actually can see imaging on an MRI that someone has Parkinson's, that the area of the brain is showing signs of black spots in that area, you've already killed about 60 to 70% of the cells that help produce dopamine. So it's one foot in the hole already. So we have to be preventive. Instead of thinking about the end, we have to think about the beginning. Does that make sense?